Hi, it's Dr. David Greene, founder and CEO of the Arizona Pain Network. Today's topic are the 10 ways that doctors are able to identify drug seekers. I'm not doing this video as a potential blueprint for a person to try and get around being detected as a drug seeker, but more as an education into how pain doctors are truly giving it their all in helping to avoid the addiction problems and perpetuation of this epidemic that we see ourselves in around the country. So number one way that a drug seeker is identified is if they keep coming in saying they've lost their prescription or it's been stolen. What a lot of pain doctors will say is, look, if your prescription is stolen, I need to see a police report. And that means that the patient is serious about it and they've gone to the trouble to notify the police and report it. Now, lost, you can't really do that, but if it's a perpetual loss situation, that becomes a red flag. Number two is if a patient comes in to a pain doctor and asks for a specific narcotic and maybe a specific dosage. They might say, I think I'm allergic to this medication. I really do better with this medication of this dose. And then if they don't get that, they get very upset. That's a red flag if it's a specific request. The third way that doctors identify drug seekers is if they have symptoms that came right out of a textbook. Well, I have this at night, I have this during the day, and my body feels better if I do this or if I move the limb in a certain position. If it really comes right out of a textbook and even using terminology that a normal layperson would not use, that's a red flag, because what it means is that that person has actually gone to the trouble of looking into a medical textbook to try and elucidate the symptoms that they may or may not actually be having. A real person just says it like it is, and it doesn't sound like it comes out of a textbook. The fourth way that pain doctors will identify a drug seeker is if they exaggerate the severity of symptoms. Here's an example. Okay, a person comes in, the pain doctor does some imaging studies, and they really don't see much on the MRI. They really don't see anything wrong on the x-rays except maybe some mild arthritis or whatnot. And the person has 10 out of 10 pain on a daily basis. Well, that's an exaggeration. It usually is just not like that. A person who has some mild to moderate arthritis will have good days, they'll have bad days. It just isn't like that every day of the week. The fifth way that pain doctors will identify a drug seeker is if that person has frequent visits to an out-of-town doctor. Now, it may be hard to know that this is going on because a lot of pharmacy databases don't talk to each other. But thankfully, most pain clinics won't allow out-of-state patients unless there's a very good reason, or it's not to get a narcotic medication. And a lot of pain doctors will not prescribe medication on the first visit, which is a pretty prudent thing to do, to make sure they know exactly the intentions of the patient, that they have pain. Now, if it's an acute pain, they've never been to a pain doctor before, it's usually a different kind of situation. The sixth way that pain doctors will identify a drug seeker is if they have overt signs of abuse. Now, this may be any number of things. They could have track marks on the physical exam. They may have signs of constricted pupils. Now, the person may be nodding in and out during the history and the physical. They may not be able to give a coherent answer. That is a sign of somebody who is taking too much medication. Now, the seventh way that doctors identify drug seekers is frequent ER visits. So if, as the month goes on and they're overtaking their medications and they're running out, they may end up going into an ER one night or one weekend and getting extra medication, as opposed to going through the proper route, which is calling the pain doctor's office and going through the usual medication refill protocol. The eighth way that pain doctors will identify drug seekers is what's known as doctor shopping. Most states, including Arizona, have a pharmacy database. The doctor can look in and see who's prescribing medications for the patient. And for pain medications, most opiate agreements say that it's supposed to only be the one pain doctor. But if they start to see that more pain doctors or ERs or whatnot are prescribing, then that's an identification of a red flag for a drug seeker. The ninth way that pain doctors identify drug seekers is if that person is possibly a new patient and they refuse to provide previous medical records. They say, you know what, I can't get them. They just won't fax them to me. I can't remember the doctor's name. Whatever the case may be, they just continue to give excuses as to why they cannot get the previous medical records. And if they actually got them, what it may show is that they tested positive for illicit drugs from time to time, or they got fired for that. It may just be, there might be a reason for that. And the 10th reason that a pain doctor can identify a drug seeker is if they're non-compliant on the treatment protocol, except for the medications. They don't show up for their procedures. They come into the office and say, you know what, I can't do a urinalysis drug test today because I accidentally peed before I got here. You know, things like that. But yeah, they're really regimented on their narcotic medication prescriptions. So that's a red flag as well. So if you or a loved one is having chronic pain and needs treatment in the Valley in Arizona, please give us a call at the number listed on the site and visit us at ArizonaPainNetwork.com. Thank you.